all. So which is why it is not news that statistics show us that women's issues are largely prevalent among urban women. Urban young women these days are disturbed for so many reasons. Earlier, back in the day, they only had the responsibility of their family. But these days, since their involvement is almost in every aspect and facet of life, everything and anything is freaking them out. So the levels of stressors have also significantly increased. Now, in addition to this, the reproductive system is not being made use of. Today, the average childbearing age is about 22 years. In the next 25 years, it is touted to go up to 35, and that's a very good thing for India to check the population explosion. However, if this were to happen, and if the reproductive system was not being used from the age of 21 years, then it is very, very important that an individual is initiated into Hatha Yoga. It is very, very important. Running to some extent works. Gymming, not quite, because it's not just about looking good. Organ health is very important. So Hatha Yoga becomes very, very essential. So Sadhguru says a girl child from the age of 12 at least should be initiated into classical Hatha Yoga. If this happens, a lot of the issues that she goes through at various development stages in her life, she will not have to go through, and she will go through very effortlessly. All the medical complexities that we see today, she will not be hounded by those. So this way, as a society, we can ensure that a woman's reproductive health is maintained, even if she is not reproducing. So some of the yogic solutions that the participants have asking me is, it is important to focus on the thoracic region, the abdominal region, and there are some processes and asanas that one can get initiated into. Always remember, you don't pick yoga up from a book. You never do book yoga. Because not only will it not work, you're going to be inviting a whole host of other things, because the word yoga means essentially union. You can't read union. You have to be in union. So formal initiation is very important. Some of the asanas and processes that are there are Paschimottanasana, there is squatting, there is Janur Shirshasana, there is Matsyendra Asana, Nadi Shuddhi, which is the pranayam that we do, there is arm chanting, Surya Kriya, Surya Shakti Yogasanas. If women are initiated into this, of course, younger the better, but all women at any point in her life can get initiated into this. Then she will make sure that her reproductive health is well maintained. So as a society, let's work towards bringing down this unnatural level of sickness that is there in society. And hopefully this program is a very profound step in that direction. So with this, again, to everyone who's joining us, thank you for joining us. We have with us Dr. Chauhan, Dr. Partap Chauhan, and co-hosting this show is Dr. Nidhi Kumar, the iconic news anchor. Yes, Nidhi.
Dr. Partap Chauhan began his journey of healing people in a simple and humble clinic at his garage in the year 1992. Look at where you've gone, sir. Since then, he's been a beacon of light for changing the landscape of traditional health and wellness in our country. And from the founder of Jiva Ayurveda, the largest Ayurvedic organization in the world, which took off with the mission of taking Ayurveda to every home. आजकल बहुत जरूरत है सर इसकी. He has penned down his expertise in two popular books, Eternal Health and Eternal Beauty, which talk about the essence of Ayurveda. And awarded the prestigious Ayurveda Ratan Award 2020 for his lifelong dedication towards the furtherance of Ayurveda worldwide. Thank you, Pratapji, for joining us on this wonderful session again. And meeting after 6-7 months of the pandemic, as we see a second surge. So as we begin our program today, please keep sending in your live questions and we'll take your queries live to be able to reach maximum individuals. Now, solutions for anemia. 40% pregnant women are anemic. It's estimated that 1/3 of all reproductive ages are anemic. And for the audience out there, anemia kya hai? When the red blood cell count or the hemoglobin is less than normal, then you are anemic. If we look at a household, either the mother or the girl child, or according to a lot of statistics, both of them are anemic, and they do need a lot of nourishment. So Dr. Chauhan, my first question to you, what are the diet recommendations, especially in these pandemic times, viewed in the Ayurveda tradition, sir?
So first of all, I would like to thank you for having me on this platform. I have been here earlier also, and it's a wonderful subject. I say so because women or females, they are the backbone of our society. Although generally it is considered that they are physically weak than the male counterpart, but I don't believe, really, I don't believe that, because if you look at what they're doing, from morning till night, they take care of the home, they take care of the children, they're doing the office work, they do everything, so I don't believe that they're physically weak. Of course, they forget to take care of themselves. This is the main problem, because while they are taking care of everybody, they forget to take care of themselves. And that's what I always advise all the females: please do take care of yourself. It's just very simple. You focus on some nutritious diet, have a good sleep, and make sure you find some time for yoga, stretching, or some kind of physical exercise, which is not really gymming and running and all that. But yoga is the best, as we all know. About anemia, if you look at from Ayurvedic perspective, in Ayurveda, this is called as Pandu Roga. Pandu means, literally means pallor or yellow coloration of the skin. According to Ayurveda, it is caused by when you are eating too much of sour and salty and spicy and fried and heating foods. Just make note of that. Maybe you are drinking a lot of coffee, or having a lot of these days smoking, alcohol, all these things. Also, other causes include excessive sleeping during daytime or overworking. Of course, malnutrition, of course, in India is a big cause. According to Ayurveda, weak digestion. Ayurveda says that when you eat the food, it converts into your tissues in blood, or rakta is one of the dhatus. So primarily, if I just
Mm.
put to one line, you should move on to what we call today alkaline diet, and stop eating acidic diets. There's a lot of things you can really do, like you can eat raisins, dates, if you can find amla in any form, amla juice, amla tablets, amla powder. In fact, in Jiva now we have amla candies also, which are very tasty. In fruits, apple, you can take. Honey is also a good source of increasing hemoglobin, or jaggery, beetroots, spinach, tomatoes, carrots. There's a lot of things available. All you have to do is just make a small change in your current routine and your lifestyle, and especially avoid all those heating stuff. Anything which is sour, acidic, heating, spicy, or generates heat in the body is going to disturb your metabolism, according to Ayurveda. In fact, in Ayurveda, we have even further divisions of this anemia, but I'm not going to go into details. We are trying to keep it simple so that you can start practicing these simple tips. And I'm sure within a few weeks of time, you will see some amazing improvement. And this is the power of Ayurveda and power of yoga. That's
Absolutely, yes, yes. Shloka, I'd like you to add for our viewers watching us, who may like to know landscape of food has changed ever since the pandemic has come in India. We're looking in for neem, turmeric, haldi, amla, like Dr. Partap Chauhan said. But aapke according, Isha ke according, what is your mandate on raw food versus cooked food? I'd like to hear that before you give a special tip on enema.
So raw food, Nidhi ji, I think we've been saying that, Sadhguru's been saying that raw food is easier to digest, right? If you look at a fruit, it takes anywhere between 1.5 hours to 3 hours to digest. But if you look at meat, it takes anywhere between 48 to 52 hours, right? Raw meat can even take 72 hours or more, but a regular meat is going to take 52 hours. Utna khana, I mean, even if you take food, say if you have leftovers from the previous night, sometimes you forget to refrigerate that food. When it's kept outside, what happens overnight? It begins to stale. Now imagine if there is meat in your stomach or cooked food in your stomach, which is for 48 hours or 30 hours or 35 hours, you can imagine the kind of rotting that is happening in the system, right? So that is the rationale and why we consider raw foods to be more healthier in nature. And certainly when we're looking at immunity and the times that we're talking about, raw food is definitely a better thing to consume. You just can't live on raw food because you'll get hungry very soon. But the proportion of raw food we say in the diet should always be greater. But the tip on anemia
On a
otherwise,
normal diet, if you'd like to advise or reach out to people today who are staying home, this is the ideal time when they could perhaps change their dietary plans. So, what would that
absolutely.
be? What would that be? Say breakfast, raw, or what? Carrots, or what? What is that recipe?
So we say you can have all kinds of raw foods, except brinjal is something that we consider negative pranic because it's actually one of the food substances which is poisonous in nature. It affects the hypothalamus in the brain. When we look at other negative pranic foods, we're looking at onion, garlic, chilies. These are some things, tea, coffee, that we ask to avoid. But otherwise, in your raw food, you can take everything and anything. It's the mango season. Mangoes are supposed to be fantastic for immunity. Raw mango is something that Sadhguru has said is an immunity booster. So enjoy your raw mangoes, put some namak, put some salt and chili and enjoy it. So anything and everything. So the thing with yogic food is there is no set prescription. You ask your body should be able to tell you what you should be able to eat in that particular meal. There is no fixed agenda. You should only eat this or you should only eat that.
Right. How about early menstruation? Shloka, I would like to take a few questions on PCOD.
Okay, I think one yogic tip that was coming to me for anemia is if you take a little bit of honey in warm water, this works very well for anemia according to Sadhguru. So maybe this is something that all of you can also try, adding to what Dr. Chauhan has already said. Dr. Chauhan, my next question to you is, due to the increased amount of chemicals and preservatives that have entered the food chain, as well as the increase in poultry consumption, junk food consumption, we see that girls are maturing faster. The onset of puberty among girls is setting in earlier. We've seen, there's so many girls out there, we see them menstruating from the ages 9 or 10 years of age. This further manifests itself during pregnancy, resulting in infertility, abortions, PCOD, and other reproductive aberrations. Can you briefly elaborate this phenomena as per the Ayurvedic vantage point?
Yeah, so it's a very good question because this is definitely is one of the problems that we also encountering in our practice now, which is called the early puberty. Of course, as you mentioned, the increased intake of junk food and processed food, chemicals, preservatives is definitely is one of the cause, and how it causes it is because our body is designed to just recognize the natural foods which are available. As you mentioned, the food with prana. This is what the body likes and recognizes. But when the food comes, which is already like we call junk. Junk means it's already garbage. So then the body is, the body's system, especially the endocrinal system, the hormonal system, gets blocked, and then there is a disturbance in the secretion. It gets, rather, I will say, it gets confused. So maybe the things that they start to like become hyperactive or sometimes underactive. So all these things we see in the endocrine system. And in addition to the food, one of the things that I have also seen is the mind. Mind plays a very important role, and especially because girls they become mature early because they're watching a lot of what we can call like the adult content in a very early age, whether it is through television or all these so-called entity platforms or like Netflix and all, even social media. And generally, if you see the girls now, they are quite matured in very young age, and even in the school and their friends, what they're talking is the content is not really what they should be talking about. So Ayurveda has suggested that it's proper food is definitely very very important. Proper lifestyle is very important, and I would say in one line, I think we need to come back to our original roots. We need to have that lifestyle which had Ayurveda and yoga as a part of our everyday. Somehow we have gone in a wrong direction, and we have brought all these problems from the West, especially because there we see such problems. I'm practicing for 30 years, and I remember when I started practicing, some problems didn't exist in India. And now all the problems which I used to see in the West, because I started traveling around 25 years, 26 years ago. Now all those problems also have come. So I think the basic Ayurvedic suggestion I would like to mention here is that we should stick to our roots. We should see from where we belong, what kind of food we should eat, and specifically the parents need to play an important role. They need to educate their children. they put some nice samskaras in them and try to
Absolutely. Yes. Yes.
lot of content which is what we call good content, positive content. It's all a matter of
Absolutely. Here, Dr. Sahab, I'd like to stop you here and also ask you to elaborate a little bit on painful period, because as we speak, there's so many questions coming up. It's
yeah,
also called dysmenorrhea.
yeah,
Dysmenorrhea, correct me if I'm wrong,
yeah,
Shloka ji.
yeah,
16
definitely.
to 91% of women go through this. And then after you speak, I'll ask Shloka also to speak about some kind of yogic exercises which can, reduce the pain of these painful periods. So,
Okay. So according to Ayurveda, the menstruation is actually facilitated by the Vata dosha. Vata is the energy in our body which is responsible for all kind of movements. And especially in the lower abdomen, there is a type of Vata which is called Apana Vata. So make sure,
hmm.
if you are having this dysmenorrhea or painful periods, so you should make sure, number one, that your bowel movements are clear and regular. And if you have any problems, very nice simple herb is Triphala. Triphala is available everywhere. You can take like in powder form, or we have also available this Triphala is in tablet form. Every night, take 2 tablets of Triphala. Also, eat more fruits and vegetables, especially fiber rich, so that you can have a clear bowel movement. Aloe vera is also a wonderful herb. You can use it in the form of juice or gel, whatever is available. Half teaspoon of ajwain seeds and half teaspoon of fenugreek seeds in half liter of water. Boil them nicely till it reduces to half, means 1 cup, and then you can add a little bit of jaggery, good, and drink it warm. Immediately gives relief. Also important in the lower abdomen, do a oil massage. This is very very relaxing, and you can do some hot towel or hot bottle fomentation. And of course, if you have serious problems, please do consult an Ayurvedic doctor. We have wonderful treatments for such problems, and it will give you good relief.
I don't know. A lot of people have been these days saying that अजवाइन और camphor अपने पास रख लीजिए, एक छोटी सी पोटली बना के, it'll help
जी,
in the pandemic. और ऐसे बच्चों के लिए मैंने खुद किया है, जब बच्चा रोता है तो हींग लगाते हैं हम नाभि में. इस तरह के इलाज बहुत देसी वो भी चलते हैं. Shloka, would you like to speak on cramps and how painful they are and what could be done to sort of ease this?
So again, from the yogic standpoint, we say Hatha yoga because it's very important for that region to be exercised. Now, not even Hatha yoga. I mean, you look at the sports people, right? You look at all the top women stars. They don't sit down because they're on their period. They're playing tournaments. They're playing matches, right? Unko to pata bhi nahi chalta when the period has happened and when it's gone. It's that effortless. They don't even get to know when. And that is how it should be because that's your body's natural response. So my yogic advice to everyone would be, please, you have to physically keep yourself engaged in any kind of intensive activity. You could play a sport, that will work, but to keep your organ health intact, please try to get into some intensive Hatha yoga. You will see in a matter of weeks, your painful period will drastically come down. And like Dr. Chauhan says, bowel movement is very important. In fact, in yoga, we say if your bowels are not clear within the first 20 minutes of you having woken up, then you have constipation because it's very, very important for the colon to be clean. I think Dr. Chauhan can attest to this, that most of the diseases that we know is because of an unclean colon, right?
yes,
Yes.
that's right.
Unclean gut, absolutely, yes. Doctor, many girls experience these kind of cramps and it disrupts their period. As she says, it doesn't happen with stars and with sport-friendly items. Could you suggest some potent tips and Ayurvedic solutions to combat this pain, Dr. Chauhan?
Before Dr. Chauhan answers, may I request all the viewers, if you have any live questions, this is your moment. Please keep sending in your live questions. We have Dr. Chauhan with us. There's no better individual who can give you solutions which work effectively. I've tried it. I've been doing your Jiva ghee for a very long time, Dr. Chauhan. So, we celebrated ghee in the yogic tradition. So, Dr. Chauhan's tips really work. If you have your live questions, please keep commenting and we'll try to get them all answered. Okay, please keep sending in your live questions.
There is a question coming in from Sharada. You may want to take that later. Yes, Dr. Chauhan. Sorry for the interruption.
Yeah, Nidhi ji, could you please repeat your question? What was your question to me?
इस तरह का जो पेनफुल पीरियड होता है उसका क्या सोल्यूशन आप रेकमेंड करेंगे to ease out that pain basically?
Yeah, so basically, as I said, you have to balance the vata in the lower abdomen. और उसके लिए it's very simple, you know, if you can take sesame oil, til ka tel, which is available everywhere, and just 3-4 days before your periods start, you know, you always know the dates normally around what time the date is coming. So 3-4 days before that, you start, you know, massaging your lower abdomen and lower back, and then take a towel, you know, dip it in hot water, squeeze it, and put it on the lower abdomen. This is a very, very effective. And in for drinking, very nice. You can drink ginger tea or mint tea is very nice. Put some honey in that. So all these things is going to balance the vata. Don't take cold water, cold drinks, cold juice is not good. And of course, don't eat something crunchy, crispy, and dry, you know, which is also going to increase the vata.
Absolutely. आजकल तो कोई ठंडी चीज ले नहीं रहा वैसे. During the pandemic, people are only going in for, you know, hot water and steam inhalation and everywhere, you know. I think the cold drinks have taken a good setback because of the pandemic, and good for that. I mean, we need to go fresh and raw and all of that. Shloka, any question from you?
Yeah, actually, before we take on the questions, you know, there are some statistics that our volunteers actually put out. You know, the dysmenorrhea affects anywhere between 16 to 91% of women of all reproductive ages, with severe pain among 2 to 29% of women. And they're so severe that their day-to-day functioning gets disrupted. Even when we talk about menstrual irregularities, we have about 14.2% of women.
And we do have bloating and anxiety and sadness and all of this and mood swings, hot flushes. Doctor, what would you like to say? This
so
problem in Shloka's video.
This is
Yes, sir.
what is called as PMS or premenstrual syndrome. So premenstrual syndrome is a set of symptoms that appear a few days before the onset of menstruation. And as you said, this may include, you know, various symptoms like bloating. Some females, they get bloated, indigestion or cramps. Mood swings is quite popular. Acne, pimples, or there can be in some cases severe, you know, fever is coming. You know, I've seen.
Right.
So
right.
Again, you know, what you need to know is that this menstruation is like a monthly detox program for the females. So you have to not block it, and which means you have to let it clean. So one reason for PMS is accumulation of toxins when the toxins don't get clean. So regular detox is a very, very nice you know, solution for all these PMS, you know, symptoms. Triphala, again, a wonderful you know, simple herb. You can take once or twice a week. So even if you are having regular bowels, still you can take on a weekend to have a proper cleansing. Drink a lot of water to flush out the toxins through your urine. Of course, coconut water you can drink. Regular exercises. You know, again, either it is yoga or some kind of stretching or some kind of other swimming exercise.
Even a brisk walk.
Yeah, brisk walk. Yes. Walking is very nice. And of course, healthy diet and good sleep. Sleep is very important. In Ayurveda,
हवा के बारे में कुछ कहिए डॉक्टर साहब. आजकल तो हवा के बारे में भी डर लग रहा है. वायु के बारे में बोलिए कुछ.
और आयुर्वेद में हमारे यहाँ पर एक अच्छी हर्ब होती है, which is called शतावरी. I always say शतावरी is the best friend of any female. किसी भी कंडीशन में आप लेंगे, आप इसको ले सकते हैं. और आयुर्वेद में हम ये भी देखें तो कौन-कौन से दोष, अगर हम तो बेसिक दोष में जाते हैं. अगर वात का इन्वॉल्वमेंट है तो वहां पर हमको क्या करना है, ऑयलिंग बहुत फायदा करती है. अगर पित्त का इन्वॉल्वमेंट है, हॉट वो स्किन में बर्स्ट होता है, तो व्हाट यू हैव टू डू, you have to take cooling things. And if you think there is a lot of, you know, bloating and kapha type of, you know, activities or action or symptoms, so then you can take something like ginger or you know, there is a mixture called trikatu in Ayurveda. So these are very nice, easy, but of course, as I always say, if you have serious problem for a long time, please do consult an Ayurvedic physician and we can give you more personalized and customized Ayurvedic medicine.
Absolutely. Shloka, can you take a few questions? Meanwhile, then I'll tell them a little bit about the yoga day also that is coming up. I'm getting a lot of WhatsApp messages for that. Yeah.
Have you taken Sharda's question? Because I just
No,
went
we've
out.
not.
to
I
the
haven't
file.
taken
Okay, we haven't taken.
any
All
part.
right. So again, I think this is a very relevant question. Sharda, if that question can be please flashed on the screen. Sharda writes, can you please advise me how to control bloating before period, and I would say even during period, because bloating always remains to be a huge issue.
No,
Okay, so
Dr. Saab has spoken on bloating.
but
There's
I
one question that came on the menstrual cycle. I think we need to take that. How does
I
one get a, jump cycle
I can give
syndrome?
you a simple recipe for bloating. Very easy to
Please.
get rid of this. आपके घर में सौंफ होती है, फेनल जिसको बोलते हैं. So 1 teaspoon fennel and 1 teaspoon jeera, cumin seeds. You put it in a cup of water, boil it nicely, and then filter it. Squeeze some lemon juice, and if you want to add a pinch of black salt or rock salt, drink it. It's very nice. Immediately you will feel relief from the bloat.
Okay,
Right.
wonderful.
I
Wonderful.
hope that answers your query, Sharada. Can we go on to the next question, Shloka ji?
Yeah, the next question, I think somewhat doctor has answered this, but I'll still answer it. Veer Anjani writes, one tip for all gastric problem.
So if you want to just get a name, there is a very popular Ayurvedic powder available which is called Lavana Bhaskar Churna. Very
Ji,
good,
ji.
easily
I've heard it.
available anywhere. Or in Jiva we have a very nice tasty powder called Digestol. Anything you're eating, you eat Digestol. It's a very tasty and good powder. But again, when you have a problem, please also try to look into the root cause. Why you are having gastric problem? Is it due to overeating? Is it due to wrong combination of foods? Is it maybe your Agni is weak? So you also always have to fix the root cause also, not taking the powder and not fixing the root cause. Then
Absolutely. Doctor, if we can flash RK's question. Yeah, so we have, okay, my period though is regular but very scanty and doesn't last for more than 1.5 days.
So this indicates, some weakness. Often when the female has a low hemoglobin or low blood, in the body, or in Ayurvedic language we call it weak dhatus. When the dhatu is weak, so I would suggest, please, raisins and dates are very good. You should eat them. The second reason could be also that there is some hormonal, there is some hormonal imbalance. For that, I would just say Shatavari. Any problem, Shatavari you can always take. Shatavari is very nice. Shatavari and Amla both. They are available in tablet form also. You can make powder, because Amla is also good for many things. It's a multivitamin, you can say mineral, and also it enhances the iron in the body. So just start with this. Try this. I'm sure this will help you.
Dr. Shatavari and Avla can be taken regularly regardless of an ailment by all women?
Yes. They're very safe and very easy. Anybody can take.
Sure. Ji. Nidhi ji.
Yeah. I'm just going on. Doctor, we go on to hormonal. Yeah.
I think menstrual irregularities is a topic that we've looked at already. PMS in particular, Nidhi ji.
Syndromes. Yeah.
PMS we have already talked about. Yes.
Okay, so the next is PCOD. This is a common hormonal disorder that affects more than 10% of women worldwide, and the numbers are exponentially increasing. I mean, as a yoga teacher, the kind of questions and inquiries that we keep receiving around this disorder is not even funny. 1 in 5 women, that is about 20% of Indian women, are suffering from PCOS as on today. This is between ages 15 to 40 years. So the polycystic ovarian disease was an older term that was kept in mind that it only affects the ovaries, but as advancements came up, it was later given the name as PCOS, which is polycystic ovarian syndrome. And some of the common symptoms that science tells us is hair growth on the face and the body. It's referred to as hirsutism, acne, weight gain, irregular menstrual cycle, dysmenorrhea, which is painful period, and infertility. Doctor, can you talk about the treatment of PCOS from an Ayurvedic standpoint? Because we understand that in allopathy, PCOS needs an early diagnosis and often a long-term management. But what would Ayurveda have to say about this?
Okay, so first of all, yes, you are very right, Shloka, that many young girls, especially, are having this problem these days. We also get so many patients of PCOS or PCOD. But if you just think about it, it's like really surprising that why in such a young age we are having this problem. In Ayurveda, we always before you search for any solution, you should always try to understand why this problem. So although most of the times they'll tell you that this is hormonal imbalance, but we need to find out what is the root cause of this hormonal imbalance. According to my experience, because we deal with a lot of people from all over the world, I've seen many cases where emotional stress or emotional trauma is one of the causes. Of course, when there is a emotional stress, emotional trauma, what happens? It gets into some kind of the endocrine system, disturbs the hormone, and causes blockage in the channels. And due to that blockage, cysts are produced, then obesity is coming, or all these symptoms are coming. So we have to work on cleansing the channels and balance the mind and the emotions. Please remember, mind is always very important, and of course, which is done by we do panchakarma treatments in Ayurveda for cleaning the channels, and we do a lot of counseling, lot of talking. And if we talk about the diet, in PCOD, you should avoid all the foods which are difficult to digest and which cause blockage, like milk products or sweets, cold foods, deep fried foods. This should be all avoided. Of course, junk food, processed foods, we never advise that. Always eat light and easily digestible foods like seasonal fruits, vegetable soups. Khichdi is a very nice diet,
Hmm.
or you can eat some kind of oats, dalia, poha, soaked almonds, soaked walnuts, strawberries, blueberries, grapes, tomatoes, watermelon. Keep all the cleansing foods. This will be very nice. And diet, in addition to diet, your lifestyle is very important. So mostly, should not be having a sedentary lifestyle. It's very, very dangerous for a PCOS or PCOD patient. Regular exercise, again, walking, jogging, cycling, swimming, yoga, and pranayam. Very important, because I did talk to you about mind and sattvic lifestyle. Mind relaxing music, positive reading, listening to something which makes you feel more positive. Hang out with positive people, what we call satsang, watching sattvic and positive content, all that which helps you to heal your mind and also heal your traumatic experiences. So that will be very, very important. In addition, of course, because it's not an easy disease, so we have to take some medicines, Ayurvedic medicines, and always medicines are to be taken after consulting an Ayurvedic physician. The medicines will continue for about 8 to 10 months, and then you will see that there are some very amazing results.
But PCOD,
Absolutely.
PCOS is easily reversible, right, doctor? Because women have this kink in their head that it is like diabetes, it is lifelong, and that's not the case.
No, it's very easily reversible. Of course, you have to have a discipline, because I told you have to change your diet, you have to change your lifestyle, and of course you have to work on your emotional and mental level also. Where you could have some kind of issues at that level. So if you don't cleanse them, they will create some blockage in your body. Anything which blocks your mind can replicate in your body, and especially in females, whenever you have emotional blockage, that will replicate mostly in the reproductive system. So either it will be
Absolutely.
the uterus, ovaries, or the breast. There can be tumor in the breast. This is very commonly seen.
So
Yes.
I'd like to digress a little bit, Shloka, because he said some very relevant points from today's point of view. Dr. Chauhan, what you said just now really touched my heart. Jaisi soch, वैसा ही खाना, वैसा ही मन. I don't know how to put that phrase in Hindi, but that is a kahavat. And let me please tell you that it resonated with me. And I would like Shloka to digress a little bit from what we're talking about now and speak a little bit about the relevance of yoga. Because I have seen that, the yogic balance that Shloka talked about, Surya Shakti and, these kind of exercises of Surya Namaskar, they would have a very embalming kind of effect on most people today, suffering from, stress and worry and all these issues. Why is yoga important? Take us through the history of yoga, Shloka. I'm getting a lot of calls on yoga. Could you do that,
Okay.
please?
So I'm going to be doing it very briefly because I'd like to hear more of Dr. Chauhan talk about his tips. But
Correct,
very
correct.
briefly, Surya Kriya and Surya Shakti and all these other practices, because Nidhi ji has recently been on one of our retreats, so she's very gung ho about these practices. When we look at classical yoga, it's about aligning yourself to the cosmic geometry. As a result of this alignment, physical well-being will happen, mental well-being will happen, but this is not what the aim of yoga is. The aim of yoga is to experience something which is beyond the physical. Life happens on many, many dimensions. Physical is just one of this dimension. But the whole essence is to transcend these dimensions and to experience something beyond. But for that to happen, it is very important that the body is in a state of ease. Otherwise, you're sitting here to meditate. I have backache, I have headache, I have constipation. All of this can be so debilitating, right? So it's to make the body at so much ease that you don't even feel like you have a body. It should be that effortless. You shouldn't even feel like you're carrying this body, which is why looking at physical well-being and mental well-being becomes so important.
And
Ji.
like you said, match your physical geometry with the cosmic geometry. Could not have put it better. And on that note, I'm going to nominate you for the GOV.in Yoga Awards. And I would like to request everybody to go on GOV web portal and please nominate your favorite yoga teacher. I've learned it from Shloka, so here she is. I'm just aligning what Dr. Pratap said. And I would request you to give her the acknowledgement that she deserves. And by the way, for those of you who don't know, Shloka is a Stephanian, a Delhi School of Economics, Trinity College, London, everything, and one of Sadhguru's most promising student. Going on to our next segment on PCOD, Dr. Chauhan, I'd like you to elaborate on some tips for menopause as well, as a lot of people get hot flushes and those kind of changes do happen in a woman's body when she's approaching menopause. तो उसके लिए क्या आप बताएंगे खाना चाहिए और नहीं खाना चाहिए?
So, again, menopause is just a natural transitional phase, of course, because as the periods start when we are in the age, enter the age of puberty, similarly at the age of menopause, the periods they stop. So it can be a very safe transition if we do not create much disturbance. The problem is that we try to create so many disturbances in this natural cycle that the woman has every month. So what we can do is, if you want a very safe menopause without much of these hot flushes and all those kind of like headaches, mood swings, all these things. So one thing which works very nicely is regular exercise. Again, it comes back to same thing. You have to do some kind of physical stretching, yoga, or not like very hard, strong exercise. Rest is very important also, especially having a good sleep. And according to Ayurveda, again, because it's a transitional phase, so there is a vata is very active, and vata is very easily balanced by doing some kind of a massage. So full body massage can be done regularly. You can do it every day. Keep your mind very relaxed and happy. And of course, there's some things you can take. There are like any kind of soya products. It can be soya beans, it can be tofu, it can be some soya nuggets. Shatavari, I'll always tell you, Shatavari, Amla, very nice. Licorice, Mulethi, which is quite popular now these days also. Mulethi or licorice is supposed to have some estrogen and those kind of hormones. Fenugreek, methi dana. Either you can make a tea. You can boil a teaspoon of methi dana or fenugreek in a cup of water and drink it. And of course, if you can find fresh aloe vera or aloe vera juice, which is quite easily available now, especially in India, it's quite all over the world. So aloe vera juice also is good. But briefly, I would just like to mention, don't worry, don't, because many times female think that now my periods are stopped, so I exist to be a woman. This is not true. This is just a time. Female is being provided with this beautiful facility to produce a child, and after that, when she has done with this so-called responsibility or job, then she has other things to do. So
अरे
don't.
यहाँ मैं disagree करती हूँ. It is not a woman's job to produce. I will request everybody not to go ahead if you don't feel the need to. That is totally your choice. माफी चाहती हूँ आपसे ये बोलने के लिए, but I totally do not agree. Moving on to our next very interesting segment.
No, I'm saying,
it's called pregnancy.
that this is a system, biological system that is provided to female. She may want to produce a child or not want to produce this. This is her choice.
बिल्कुल.
But once it is, the time is over, then she should not feel like, because many females, they feel like now I'm not a female anymore because I have no periods.
Correct.
So they should not feel depressed about this. Life, you have many other things to do in your life. Amazing things.
Correct.
Yeah.
Shloka, any yogic perspective on menopause?
There are certain asanas, like the asanas that I mentioned, and the yogasanas in particular. A lot of chanting that we do, bhakti yoga. There's chanting. There is the certain chants which we do as a part of our online programs and offline programs. So if these are done, of course, the other aspects of hatha yoga you keep intact, you will see that this transition becomes very effortless. And top that up with the power-packed advice that Dr. Chauhan has given. I think it should really work. But in particular, I'd like to mention the Shambhavi Mahamudra Kriya. I don't know how many of you have been initiated, but it's offered as a part
I have.
Okay, it's offered as a part of the Inner Engineering program. Now it's happening online as well. So that is something you may want to get initiated into as well. We've seen a lot of women make the transition into menopause easily with this particular sadhana. With this, there's a live question that's coming that I'd like to take on. The question is that my daughter is 17 years old. If you can please flash Revati's question. She has irregular periods. Presently, it's 4 months since she got her last period. What should I do in this time of Corona where we are hardly moving out?
So, because the periods have not come for 4 months, this is definitely indicating towards PCOD again, because that's one of the main symptoms of PCOD, and this is very, very much happening in the young girls. So I will give you just, because you can't move out, and of course, if you want, Jiva has this facility of having a teleconsultation, and we have great, female doctors, gynecologists, Ayurvedic specialists, who can personally, talk to her, and they can understand the root cause. Just if I give you simple some recipes at home, you want to try them out. If you can find again, ajwain is in your kitchen. It's all everybody has ajwain. So you take about a quarter teaspoon of ajwain seeds, and then you'll have to find maybe carrot seeds if it is available. Carrot seeds and ajwain seeds you boil in a cup of water and you drink it. In Ayurveda we have quite nice medicines, nice tablets form or some powder juices that can help to again detox the reproductive system if there is any blockage somewhere, and of course stimulate the hormones also. So I would again say, you can at home you can work definitely with the apanvata, oil massage and hot fermentation, and keep the bowels clean, as I have already mentioned, because that's the area where apanvata gets blocked. And then please consult one of our doctors, and they will definitely we can ship the medicines to your home.
You can keep answer them live, because we do understand that it is difficult in times like this to see a doctor. We have Dr. Chauhan, and he will answer them for you. Moving on to the next segment, which
One
is
more question. One more
pregnancy.
question. I would like. There's one more question, Nidhi, that has come up. Kavita writes. There's many questions actually, but I'm sorry, but I'm pausing you in between. But we'd like to address the viewers first. Kavita, if you can please flash Kavita's question. Diet that we should follow for a girl child from a very early age. Again, a very popular question, something that I keep getting as a teacher.
So, again, very important from Ayurvedic perspective, our main goal when we are eating food is number one, to nourish our dhatus in the body, which is very, very important. We know we don't go in terms of like vitamins, minerals, and that stuff. So,
Hmm.
that is one thing. And as Nidhi ji mentioned, let me tell you that jaisa khao an vaisa bane man. So we are also eating for the mind. It's not just so make sure, because children these days they are eating a lot of this what is called processed food or junk food. So there's no prana in this food, and there is no even nutrition. So what happens? Our dhatus get depleted. So I'll just suggest in whatever area you are living, again go back to your traditional foods, whatever which part of India or part of the world you are living. Fruits, vegetables, nuts, seeds are very nice. And when it comes to grains, make some traditional recipes. No, not only necessary all these bakery items, bread and buns and all. Those are not considered very healthy. So make, even if you make chapati or make some bhakri, or there's so many things in India we make in every part of India. So, and most important, when we say food in Ayurveda, it's not only what we are eating from the mouth. Anything that goes in, what you're watching, what you're hearing, to make sure the child, what they're playing on the tab, what they're watching in the TV,
Hmm.
this is very, very important. You have to make sure everything that is going in is clean, pure, and what we call sattvic.
एक
Absolutely.
एक एक मैं भी देना चाहूंगी सबको अगर इजाजत हो. I saw that question flashing on the screen. That is something my dad has taught me ever since I was a child, and I never had a single pimple in my life actually. So that is eating raw neem leaves. I do that till date. Every day I eat a bunch of neem leaves, and I don't even require water after that. So I think that takes care of the entire system and the inner chemistry inside. Whatever you have to say, geometry,
Neem,
as Shloka ji would
neem,
put.
neem is like a pharmacy in itself. Neem has many,
Hmm.
many wonderful properties. It's antiviral, antibacterial, cleanses the blood, and for stomach, for gut bacteria. It's nice. So fresh neem leaves can be taken in the
And
morning.
it's freshly available. हर गली में आपको नीम का पेड़ मिलेगा, so go for it. Coming back to statistics, so approximately 12 million girls aged from 15 to 19 years, 87 lakh 77,000 girls under 15 give birth each year in developing countries, right? The maternal mortality rate, MMR of India, stands at 61%. Women are dying as a result of complications during pregnancy and even abortions, so or childbirth. So 17.9 million women in India alone suffer from infertility issues. So to you, doctor, my question is, what preparatory steps does a woman need to take to plan her pregnancy? The first 5 months are crucial. तो यहीं पे कुछ ज्यादा एहतियात रखना पड़ेगा. क्या कहेंगे आप?
It's a very, very good question. And I always tell people that, we plan everything in our life. So why can't we plan a pregnancy or a child? Because these people never plan. This just happens. They
हाँ.
just suddenly find out, okay, I'm pregnant. So, like you plan your weekend, you plan your vacation, everything we plan. So, we have a very nice program in Jiva. We call it Jiva Ayurvedic program. And this is like, it's not like just the pregnancy, it's before pregnancy. So, 3 months before pregnancy, both partners, we do a program for them, which is preparing them physically, mentally, and spiritually. So 1 month is detox program, physical and mental, and then there is nourishment, rasayana, and then conception, and then during pregnancy there is a complete 9 month regimen for every month. So I would tell people, just I'm just giving you a very simple hint that this is one of the most important things you have to do, because children are our greatest asset. Children are our future, and if my child is good, healthy, spiritually, mentally, physically, then this is a good, good for me, even in my old age, because they'll be loving and taking care of me. So please, you
बिल्कुल
must.
डॉक्टर साहब, यहाँ बताएंगे आप कुछ गाइडलाइंस फॉर अ वुमन टू फॉलो इन हर फर्स्ट ट्राइमेस्टर ऑफ प्रेगनेंसी, पहले
So
5 महीने में उसे.
first trimester very important, and especially I would say in Ayurveda it is written that first trimester the woman has to be very, very careful. It is written that It's like a ball of oil, full of oil. When you have to carry it from one place to another, you have to be very careful, otherwise the oil may spill out, which means the miscarriage may happen in this first 3 months. So the woman must be not doing too much of hectic activities. She must be not doing some bumpy rides, especially traveling, not running up and down the stairs, and especially mentally she has to avoid stress, anxiety, and too much excitement is not good also. In the food section, all the heating foods and also heating medicines should be avoided. Gentle oil massage all over the body, good sleep, and most important, the female needs lot of love and emotional care, not only from the husband but from the entire family, because this is like a new experience for the female, especially if she's getting pregnant for the first time. So she is going through a lot of changes, a lot of challenges are
बिल्कुल
there.
सही, बिल्कुल सही। एंड टू ऐड टू दिस एक और सवाल है जो काफी लोग जानना भी चाहते हैं, डॉक्टर साहब, हाउ डज अ वुमन इंश्योर दैट शी गोज इनटू सेफ लेबर इन द लास्ट ट्राइमेस्टर ऑफ प्रेगनेंसी? वो भी बहुत जरूरी है, सी
बहुत
सेक्शन
जरूरी है,
एकदम हो जाता है।
बहुत जरूरी है, और उसके लिए बहुत इंपॉर्टेंट है कि लास्ट ट्राइमेस्टर में यू हैव टू स्टे एक्टिव, एक्सरसाइज, योगा, स्ट्रेचिंग, स्वेटिंग, आपने देखा होगा, इट्स क्वाइट कॉमन. एंड अगेन, internal oiling and external oiling, both. Outside oil massage with sesame oil, internally you have to take ghee, lubricated meals, warm and soupy foods. Don't take cold, dry and crunchy, crispy. Avoid gas forming foods, all these foods like beans and cauliflower which are gas forming. There should be no constipation, because if you get constipated it's going to create problem. Again, Trifala, I keep telling you from the very beginning, keep your mind positive, pranayama and meditation, read positive books, spiritual books, have a good sleep, and very important, again, I will say, you have to have a lot of love and support, especially from the husband, because you are going to experience another, very difficult time when giving birth is a very, it's kind of a painful experience, of course, but
It's a
when
new life almost. Shloka, would you like to add to this perspective, please?
So the yogic perspective is that I think quite in line with what the doctor has said very rightly, from preconception to conception and various states of pregnancy, delivery to feeding, there has been an elaborate system, an established process in this country. That is how a woman should eat, how she should interact, the forms that she should be looking at, the forms that she should not be looking at, the sounds she should be listening to, the sounds she should not be listening to, the kind of people she should be meeting, the kind of people she should not be eating, the kind of reverberations that she should be exposed to. So all of these things were very profoundly looked at in this part of the culture. But today, all of this is lost because of social and economic conditions. Women are in buses, they're being pushed around, they're being bombarded with all kinds of sounds, noise, abuse even. Women are therefore not able to dedicate the required time and attention that is required for the baby. And in some sense, all of this chaos is getting translated onto the child, whether we realize it or not. In fact, Sadhguru says that the level of intelligence invested in the body is such in this time that if a woman produces a male child, the quality of milk that she oozes out will be very different if she had to produce a female child. If she has a female child, the quality of milk is very different. Let's say she had twins. Then you won't believe it that one breast actually oozes a different quality of milk and the other breast will ooze out a different quality of milk. So this is the kind of investment that nature has done, which is why it becomes so important that pregnancy is not just seen as a breeding mechanism, but it's actually about nurturing the next generation, and it should be looked at with profound care.
Absolutely. And, today we are all lost because of social and economic conditions, especially in the pandemic. And as you rightly said, that women are being pushed around everywhere, and it is only right that we take more care. Thank you for that absolutely wonderful perspective on pregnancy. We go on to lactation now, which is again a very, very important issue, friends.
Nidhi ji, we'll take
Globally,
one
3 in
question.
5.
We'd like to take one live
Right?
question because there are many live questions coming in. Okay, so
Right,
Savita's
Shloka ji,
question may
please.
be flashed, please. If Hani Akka, if you can please flash Savita G's question. How to get rid of extreme fatigue, lack of energy, and lack of sleep associated with estrogen depletion in menopause?
So, it will be very easy. Again, the disease can manifest in many ways, but, you will see that the root cause is very, very simple and similar in many cases. One is your lifestyle. When we have a lifestyle which is, irregular, especially, you are staying up late in the night and waking up
Hmm.
late in the morning, and there's no routine for eating, there's no routine for exercise. So that is what causes all these kind of symptoms, lack of energy, and all this. And definitely the second is your food. And food, again, we are eating in a hurried way. Sometimes there's no time to eat, or we just pick up some kind of snack and just run on the go. And of course, a good sleep. If you don't sleep well, put some nice aroma in your room, put some nice music, massage your feet. A good sleep of at least 6 to 8 hours will rejuvenate your body and mind, give you a lot of energy. And make sure, again, you don't fill your mind with all the garbage. That also depletes your ojas, it depletes your prana, it also depletes your tejas. These are some of the subtle energies in our body which are depleted by what we say rajas and tamas.
Doctor, anything in particular, any solution or natural remedies you can give towards remedying insomnia and anxiety?
So for insomnia, as I mentioned, very nice. You can have a cup of milk. A cup of milk, put a pinch of cinnamon powder, a pinch of cardamom powder, and 1 or half teaspoon of fennel seeds. It's a very nice formula. Boil it nicely, drink it warm before you go to bed, and also please make sure if you're going to bed at 10 o'clock, you should make sure 1 hour or at least 45 minutes before, switch off all the gadgets, disconnect from any kind of stimulation, because as long as you are stimulated, you can't fall asleep because your mind is fully awake. So it's again, come to your room, lie down, do some meditation. You can do some shavasana, or massage your feet, and I'm sure you will have very wonderful sleep. If you still need good sleep, we have very nice tablets called Jiva Sleep Well tablets. They're amazing. They just relax your mind and brain. And regularly on a weekend,
Bilkul,
or
bilkul.
the weekend, you can do head massage. Head massage, or
Yes.
if you can do it every day, it's also wonderful. And take a shower or bath in the evening. That will put you to nice sleep.
I'm sorry, I didn't get the last part. Take the.
Take a shower or bath
Okay.
before you go to bed, or in the evening before dinner will be nice also.
Perfect.
Absolutely. We move on to our next segment, Shlokaji and Dr. Chauhan, uh, which is lactation. So globally, I'll give you a few figures first. 3 in 5 babies are not breastfed in the first hour of life. Over 8,20,000 children could be saved yearly if all children were optimally breastfed. Only 41% of infants under 6 months of age are exclusively breastfed. Regarding issues arising during lactating period of a new mother, like low production of milk for newborns, what is suggested in Ayurveda? क्या कहेंगे आप एक lactating mother को जिसे दिक्कत हो रही है?
देखिए सबसे पहले वेरी इंपॉर्टेंट बिकॉज शी इज फीडिंग द चाइल्ड सो शी हैज टू हैव a गुड डाइट एंड उसमें भी आयुर्वेदा सेज ड्रिंक मिल्क यू कैन गुड क्वालिटी ऑफ मिल्क अच्छी क्वालिटी का मिल्क लें और 2-3 बार दूध पिए बिकॉज मिल्क विल क्रिएट मोर मिल्क वेरी इजीली and you can also have again shatavari is very nice in any condition especially for lactation also. So you can have shatavari with the milk. You can have fenugreek, methi jo hoti hai, methi either you make a powder, and methi powder you can take like a teaspoon every morning with water or with milk. This also stimulates lactation. Anar, pomegranate you can eat, or pomegranate juice is very good. Specifically milk products are good. You can have paneer or ghee, buttermilk. All these things will be very very useful. And get some rest. Sometimes the mother is not able to sleep properly, So try to manage your schedule so that you can have a good sleep, and especially also the oil massage in the body is very, very nice, because it will stimulate the
Absolutely, yes. Yes.
various
You added
channels.
so much on this very important thing, that this is the diet and this is the rest that one needs for a lactating mother. Shloka, I'd like you to also speak a little bit about infertility, because this also happens to be a huge problem in the country.
Right. So before we talk about infertility and I ask my question, doctor, in terms of diet and rest, you've already talked about so many things, but what is that one thing that we can look at that can ensure that the mother's milk is profuse, it's sufficient for the baby? Is that any one particular remedy?
Even if, like, if you can catch hold of shatavari, it's very
Okay.
nice. If you don't find, then fenugreek is available everywhere. So fenugreek powder, and take a teaspoon of it twice a day. It will be very, very, very effective.
Sure. So infertility, 60 to 80 million couples are suffering from infertility worldwide. And one of the common reasons and the causes is fibroids among women that causes these issues of infertility. So what solution does Ayurveda provide for infertility caused by fibroids? And is there any complete healing solution for infertility in Ayurveda?
So again, infertility, we do very nice treatments for infertility, because again, if you look in our Ayurvedic books, they have given a wonderful explanation of how this whole process is designed. So there are four parts of it. Number one, it's like, planting a tree. So first you need land. Land means the land should be fertile. So land here is the uterus of the female. So we do a cleansing, if there is a fibroid or if there is any inflammation, there is endometriosis. So we do panchakarma treatments for that. And second, the second thing which is very commonly found these days in the young couples is that everything is fine, but they still are not able to produce children, because the seed, so if you don't have good quality of seed, the plant will not grow, even if the land is fertile. So there is the sperm from the man and the eggs from the female. So what we do is we have very nice, Ayurvedic herbs and formulations to nourish the seed, the sperm and egg. And of course, then the third thing is the time of the fertilization, when they should meet. That perfect time, the egg is ready to receive the sperm. And then after the fertilization has taken place, it's important to nourish it. Otherwise, it will not grow. Many times they will come that there's no growth, or there's no heartbeat, some heartbeat is not coming, or they'll say miscarriage happened. So these four aspects are given, and we do wonderful treatments. People are very amazed to see that, I was trying so many years with all these different kind of artificial techniques, and also in some cases we do specific panchakarma treatments, especially when it is like fibroids or something. There is a specific, Uttar Basti. So
We want you to tell us about fibroids, because there are questions coming in on fibroids also.
yeah,
Please
this is what I'm saying, that in case of fibroids, we have to do it by two ways. One is panchakarma, which is like cleansing at the minute level, and then there are some medicines which we give internally. So I will suggest, if people have any kind of gynecological issues, any kind of female issues, please feel free to go to our website jiva.com, and you can always have a consultation with our gynecologists. They are wonderful. They are doing amazing work.
So we'll be flashing a question. Bharti Santosh, I have mood swing problem, hormones imbalance, detoxer said eggs quality is not good, hardly have chances to conceive. Please tell me some tips.
So again, I just mentioned that whenever you have a problem, that you have been told that there is a problem with the quality of the seed, or there is a problem with the egg size, or the egg is not matured. All this is coming under the seeds. So in this case, what we do is we give some personalized, customized formulations, medicines. But if I just want to tell you something, for the males, ashwagandha is very nice. Is easily available. The male partner can take ashwagandha. Female can take shatavari. Shatavari is always, in any condition, shatavari is good for the females. Amazing results. So these are the two things. But please, because you have some specific problem, So this cannot be just solved by some home remedy. You have to have a proper, consultation and get proper treatment. But the good news is that there are very nice and very successful Ayurvedic treatments. Every other day, my doctors, just message me. This lady came to me and they were trying to conceive for last 6 months, 6 years or 10 years, and now she is pregnant. So this is such a good, feeling for the doctor also, because they feel happy that somebody is finally getting to see what they were planning to do, or their dream is fulfilled.
Gee. The next question is, can thyroid be cured, or do we need to take medication all our life? Please advise, as thyroid is becoming a lifestyle disease now.
So, of course, in Ayurveda, we do have treatment for thyroid, and in Jiva, we also do treatments. And it takes almost about 1 year of treatment, especially for those who are already taking tablets, because we cannot stop their tablets immediately. So first we start Ayurvedic, and they are also on the other tablet. Then slowly we reduce the quantity. And this again, thyroid is a metabolic disorder. We all know that. And we work on the Agni. If it is hyperactive, we have to calm it down. If it is hypo, which is slow, we have to stimulate it. And again, in thyroid, I would like to mention my personal experience. Many females, when they enter into their 40s, they have this. So again, a lot of stuff is going on there. So we have to always, females are very emotional. They always need to be taken care. I always say that. And if females are taken care, they are like God. Naryastu yatra pujante ramante tatra devta. This is a very famous verse from Manusmriti, that if females are respected, if females are taken care, then it is all heaven here. So I request,
शक्ति है. अब हम देवी से ही निवेदन कर रहे हैं कि इस पैंडेमिक को खत्म कर दिया जाए. बिल्कुल. Absolutely.
So Poonam writes, near the uterus, she has a fibroid near the uterus, and its size is increased now. It is 11 centimeters. Is there anything that she could do, or does she have to come under medical supervision?
So this size is quite big. I would say that in some cases, it's not always that Ayurveda is going to work in every case. So in some cases, it is necessary to go for a surgical intervention also. So if it is an initial stage, very small size, then we can definitely, and in that case also, we always, work with the patient. We talk to them and we tell them, okay, let's see what happens after 3 months. And in 3 months, if we see that, okay, ultrasound shows some improvement, then we go on. So it's not always that Ayurveda can cure all the conditions. We have to be very practical, and also we have to see the disease.
G. So the next segment is on osteoporosis. Worldwide, osteoporosis causes more than 8.9 million fractures every year, and this correlates to an osteoporotic fracture, which is 1 every 3 seconds, with 1 in every 3 women falling prey to this. The main cause of osteoporosis is said to be bone loss due to a drop in the body's estrogen levels. And 80% of Indian women end up with this problem. And as old age dawns, we see more elderly people in the women's population end up with fractures and brittle bones. Doctor, can you talk about some Ayurvedic remedies and diet to combat this problem, and that which can help strengthen the bones?
So, of course, according to modern medicine, as you mentioned, that, after menopause, when our hormones have diminished or become low, so then there is our bones become deficient in calcium. So many ladies, they're advised to take calcium tablets. In Ayurvedic terminology, again, because bone is one of the dhatus, one of the 7 dhatus, so we consider this as a dhatu kshay. And dhatu kshay, again, we have to see what is the cause. It could be some kind of a impairment in the metabolic process, the Agni, or it could be the nutrition part of it, any one of that. So some things that we generally advise to people is sesame seeds. So sesame seeds easily available. You can either roast them and eat like a teaspoon every day. Milk products, are very effective. You must drink milk every day, every night. You can also put some little bit of turmeric powder, there's a quarter teaspoon of turmeric powder in that. Often, try to have some fresh paneer or dahi, yogurt, buttermilk. All this is very important. And in Ayurveda, the oil massage also helps. When we massage our body, it nourishes the muscles and the bones both, because bones are the seat of vata and there is dryness there. That's why joints are cracking. So oil massage with sesame oil will help. And of course, finally, the Shatavari, never forget that. It's always in every
Yes.
condition use it. And good diet and good lifestyle is always very important.
Jeet. So we had one question in this regard coming from Aparna Reddy. Please explain how to deal with joint pains at the end of menopause.
So joint pain is lubrication is needed, because again it's vata disorder. When vata is there, it causes dryness, and when there is dryness, the lubricant in the joints becomes dry. So physical local application of oil is very, very important. Internally, because we are talking again about vata, you can make a very simple recipe. Three things: ginger powder, fenugreek powder, and turmeric powder. All these three things mixed in equal quantities, and from the mixture, take 1 teaspoon in the morning, 1 teaspoon in the evening. You can take it with warm water or with warm milk. This is going to help. But again, stay active, do some kind of yoga exercise, build your strength of the calf muscles and thigh muscles. And if you are overweight, please make sure that you lose weight, because overweight is also a cause of knee joint pains. In very many cases, we have seen that.
Doctor, my last question to you is on women. A lot of young girls are talking about acne, and especially through their reproductive age, puberty, onset of puberty. Whilst puberty, we see that acne remains to be a very major issue. So, what can you suggest, doctor? Some natural ways to combat this?
So again, a very nice question, a very common problem: acne, pimples, and hair loss. In Ayurveda, this is all caused by too much pitta, too much heat. So please watch your diet, because from morning till night we are increasing pitta. Chai, coffee, spicy, all the fried stuff, all the chemicals, preservatives. This is all going to increase pitta. So try to cut down. If not, you cannot stop. Cut down on this and get something more alkaline. Coconut water is very good. In the season, watermelon, cucumbers, green vegetables. And as Nidhi mentioned, the best thing is eat neem leaves in the morning. Very nice, because they will purify the blood. And neem also brings down the pitta in your body. So this you can start. Don't put all these chemicals and creams and all those kind of stuff on your acne, because sometimes you put some creams and we start taking some antibiotics. Just cleanse the blood. Anything bitter, neem, karela is also good. Karela juice you can buy. It's very easily available from our online store also.
Because जैसे आप कह रहे हैं सब कुछ internal होता है, external नहीं होता, तो internally उसको सही करो.
Internal is very important. Yeah. And please always remember, this is your body. You are responsible for what you are putting inside, not from the mouth, from the eyes, from the ears. So always, be a little bit, kind to yourself. I always say, be kind to yourself, love yourself. Don't just, destroy yourself. And this is what you have to keep in mind. Then make small changes, take small steps. Go back to your roots. You will love it. You will enjoy your life.
Doctor, there are questions about Nidhi ji. There's one thing about Shatavari, since doctor mentioned. Can you please mention the dosage, doctor, for Shatavari?
Okay. So if you take in the tablet form, you can take 1 or 2 tablets. 1 tablet is normally 500 milligrams. So 1 tablet or 2 tablets every day. And the second thing, if you take in powder form, take about 1 teaspoon, small spoon, which is a teaspoon. And this is the dose. You can take it every day.
And all women can take this regardless of their age, correct?
Anybody can take it. It is the woman's best friend. It will never irritate.
Perfect. Ji Nidhi ji.
We're absolutely out of time. Thank you so much for your time, and we're going to request you again and yet again and yet again, and you can't say no. As we conclude today's session, there are some special announcements which we need to do. Shloka will be doing. Dr. Chauhan, I can't thank you enough for this absolutely enthralling wisdom and very informative program. Your pearls of wisdom conveyed in such a succinct and articulate manner is so easy to implement and understand. I'd like to extend our generous gratitude to our co-hosts, India Science, Yogic Life, Sadhguru Darshan, Ayurvedic, Sadhguru Sense, Sadhguru Healing the World, Jiva Ayurveda, and of course, Mitro. Our volunteers, Hani Akka, Abhay Anna, Arjun Anna, Stravani Akka, and so many volunteers who work behind the scenes. Alia, Amaya Akka, Pavel Anna, Harshita Akka, special thanks to all our digital volunteers from Abu Dhabi. Can we have their logo, please, Hani ji? And I'm sure this is going to see a lot of views and lots of likes. So please go on with them before I make another special announcement, which I need to do. Shloka, can you tell everybody about the special programs? I need the Abu Dhabi logo, please. Honey, is that possible, please?
So thank you, volunteers. Volunteers are the pulse of what we do, and they do it without any incentive. So that's the biggest sadhana. Without thinking about what is going to happen for this one, if you can just give. What about me? What am I going to get out of this? Nothing. That is the biggest sadhana. And I can never thank you from the bottom of my heart, dear volunteers. You've been with me through all the programs and through Ask the Masters and in these times. I'm so indebted and grateful to each one of you. Thank you so much for making this happen. I will never be able to thank you and your profuse contribution into making this what it is. So thank you so much.
So Dr. Partap, before we go and before we end today's session, I'd like to, and before Shloka made a few announcements on yoga, I'd like to add something. Since I just got a call from Abhay, please click on the link below, download the app, India Science app, as well as the Metro app, and create a short 30 seconds video of your best yoga teacher. I have nominated Shloka because I've been attending her programs, and I'm sure Dr. Chauhan is also going to do this. So you need to put your entry on the Pradhan Mantri My Yoga web portal. And as we all know, our Honorable Prime Minister has brought yoga to the world. So 21 June अब एक योग उत्सव के मायने हैं उसके, and it's celebrated by 194 countries globally. So I've nominated her. Let's share this and also give Shloka also the acknowledgement that she deserves. Anything else you'd like to add, Shloka? I'm sure you didn't want this, but yeah.
So the upcoming programs, the Yogic Food program starts on the 1st of May. The Dvijas online yoga program, 30th of April and 1st of May. And the Bloom Children's Camp is going to be starting, the yoga program for children is going to be starting in May. So contact the number which is flashing if you wish to enroll. All of these programs are designed by Sadhguru, and because of the pandemic, Sadhguru has opened up these programs online, and we teachers are there to offer this to you. So hope you have a great day. Hope this session has proved immensely beneficial. And Partap Chauhan ji, thank you for making this so power-packed and so wisdom-packed. And thank you for this contribution of yours.
Thank you. Thank you for inviting me. It's always been a pleasure to be, on sharing the stage with both of you, and I really enjoy it. Thank you very much. And I will tell everybody to please take care, stay safe, and stay healthy.
And mask up India. Yeah. And on that note, many thanks for watching. Keep watching us at India Science. Namaskar.